So what we're going to talk about today is that relief is possible, a new path forward for your knee pain. We're going to have conversations about how to get back to the things that you enjoy. Knee pain specifically is one that kind of limits us from doing a lot of things. And so we'll talk about that and talk about maybe why that is. But a little bit about me. So I opened this practice in 2015, and I had been a PT before that, specializing in orthopedics. And let's see, that's a long story. We're not going to go into that. But when I opened this practice, I was an orthopedic specialist, but I wanted to specialize in spine-related treatment. You're like, that's not why we're here. We're not here for spine treatment. But I specialize in scoliosis. I have a podcast. I am a member of international societies with that. But going specialized into that, we actually started to get into some regenerative treatment for our spine patients that kind of cool technology that's coming out that we're going to talk about. But it's been used for orthopedic problems for a long time. And there's a lot of research behind that. And so now that we're using that with our spine patients, I'm like, this is great for knee pain. So that's why we're talking about knee pain today. I'm a native of Utah, and I have 4 kids. One just got married a month and a half ago, which makes me feel really old now. But at least I don't have any grandkids yet, but I'm excited for that. So then Corey in the back here, maybe Corey, introduce yourself a little bit.
Hi, I'm Corey. I was actually a student here back in 2017. I was here for, what was it, 3 months or something?
Yeah.
It was a really long job interview. And but I didn't know that I would have such a strong interest in treating scoliosis at the time, so that was developed, and I've been here for about 7 years now, going on 8. And I'm from Alabama. My wife is from here. We have 3 kids, and I've loved being able to serve everybody here in Utah, and excited for this new treatment option that we're going to be talking about today, and I'll be demonstrating that later. So.
Roll Tide or Tigers?
Oh, Roll Tide. Absolutely.
Not even a question.
Yeah, not a question.
So Corey just got back last weekend from some training on a shockwave treatment that we're going to talk about today. And probably some of the most intense training I've seen on regenerative therapies and stuff like that. So he's going to take over in a little bit, but I want to talk about a few things before he takes over. I want to talk about why you guys are here, because I could talk about what I want to talk about knee pain, but that doesn't really mean anything to you guys unless we're addressing the things that you want to talk about. So we have a decent number of people, so maybe we go around and we see what kind of common themes are, questions that you guys have that I can answer. So, and then I'll write them down, and we'll make sure at the end that I'll try to hit everything that's on the list. So what are you looking to get out of this? Why are you here? Let's start here, Tina. Okay. So, okay. Well, it sounds like we have quite a variety of things. Osteoarthritis being a big one, but we also have some other things. So I'll try and mix those in a little bit. Do my best with that. I mean, obviously I can't cover everything that's on there, but I think the big thing is you're not alone in this journey. I mean, this is something, knee pain is very common. I was looking up the statistics, and what do they say, 90% of statistics are made up anyway, so. But these resonate with me because this is what I see in my practice. 25 million Americans have knee pain. That's a lot. I mean, there's a reason there's this many people in this room. 54% of those over 35 experience knee pain regularly. And that kind of surprised me. I'm like, but I've had my own knee pain, so why does that surprise me, right? 60% report limited activity. And that's kind of a theme through here. You want to stay active. You don't want to limit your activity because of your knee pain. So, and one thing with me, most physical therapists you'll find got into physical therapy because they have their own problems, their own injuries. And I am no different. Back pain, knee pain, shoulder pain, I don't have scoliosis, but I treat it all the time. I mean, it's something that I live with as well. So what's the issue? We could spend a whole day on what problems there are with the knee and why they happen. That's not the purpose of this workshop. We have osteoarthritis, which is cartilage breakdown and degeneration in the joint. We have meniscus tears. It's interesting how many of you talked about meniscus tears. They're very common. They can be very painful, but the research right now is showing that non-operative and operative are similar results. That's why they probably told your husband, you just have a meniscus tear. I don't think that's the best way to address a meniscus tear, but yeah. We have ligament damage, there's tendonitis, there can be tendonitis along with osteoarthritis. There can be overuse and repetitive problems that happen in our athletes or even just from jobs. We have past injuries that happen. You crash on your mountain bike and tweak your knee, and then that accelerates osteoarthritis. So we have a lot of things that play with each other. We also have knee replacements that have to be redone and have more scar tissue. So there's a lot that goes into knee pain. We can't just talk about knee pain, although we're just going to talk about knee pain today. But it's more than that. There are many more things than that. So how many of you feel like this, stuck in a cycle where the pain starts, you reduce your activity because it hurts, right? Because you reduced your activity, your muscles get weak. Then that muscle weakness doesn't allow for stability in your knee, which then causes more pain, which then causes more decreased activity, which causes more, I mean, we can keep going on all day with that, right? Who's noticed that? Anybody?
I notice it, but I ignore it.
But you ignore it and you keep the muscle weakness from going, right? As best you can.
I do non-weight-bearing activities,
Yeah.
so I can be alive.
So you've tried to compensate for it, right? So this cycle is what I see almost in all of my patients. Usually I'm not seeing someone for pain, you're like, what? You're not seeing someone for pain. I'm seeing someone because that pain is stopping them from doing something. That's when we're motivated to do something about it, is when the pain is bad enough that it stops you from mountain biking or it stops you from walking, things like that. So stuck in the cycle. Why won't it just heal already? I've had patients tell me this. I sprained my knee skiing. Why won't it just heal? It's been 4 years since then. Why won't it just heal? I'm doing everything I should. A few questions that I have. Who thinks inflammation is the enemy? Yeah?
We're told it is.
Okay, you're told it is.
Other things.
You're told it is. I like that. We'll talk more about that. Why does healing get stalled? Why doesn't it finish the process? We'll talk about that. Can we jumpstart the healing? And why do our pains become chronic? I mean, those are questions I bet all of you have. It's like, why won't my knee just behave and do what it's supposed to, right? So this is something, I had ChatGPT make this image, so it's not exactly what I wanted, but it'll do today. This is what I talk about with my patients a lot. So when you have an injury, inflammation happens. That inflammation serves a purpose. Our bodies don't create inflammation just counterproductively. Inflammation brings cells to the area, it brings things to the area to help heal the tissue. Okay, so I think this is something really important to understand. Inflammation is not the enemy. Excessive inflammation might be, but inflammation is the way that our bodies heal. That's the way we go from inflamed to healed. I put stalled healing in the middle because if something disrupts that process and the inflammatory process can't finish, then we get stuck. So a classic example of this is someone with like tendonitis, like tennis elbow. So they're doing something, they irritate this, there's some damage that happens to the elbow, it gets inflamed, it starts to heal, and then they're sitting at their desk working, creating more stress, not allowing it to finish the healing process. Not that we have to rest from everything, but the inflammatory process starts and then it gets kicked back a little bit, and then it starts and tries to go to healing and it gets kicked back, and then we get stuck in the middle. We get stalled where it's not healed and it's not inflamed, it's stuck in the middle. So I think with chronic problems, this is what's happening a lot of times. With degeneration in the cartilage and stuff like that, it's a little different issue, but anytime we have chronic pain, there's some of this happening. Scar tissue, definitely, this is happening. So how do we break the cycle? So we have to address the underlying root cause, not just the symptoms. If we're just addressing the symptoms, ibuprofen, cortisone injections, things like that, it's not getting to the actual underlying problem. Let's say the meniscus tear. We can inject the joint, calm the inflammation down, but the tear's still there. Nothing's addressing the tear. Nothing's addressing the degeneration. We have to address the underlying cause. Does that make sense? So if we're, yeah, we can talk more about cortisone injections there. Yeah, we'll talk more about that. So what's the cost of waiting and doing something with knee pain? We already talked about the cycle we get stuck in, right? The waiting reduces our activity level. We have missed experiences. Who's backed out of an activity because of your knee pain? Yeah, give me some examples of what those are. What activities?
Pretty much everything.
Pretty much everything. Okay.
I have Parkinson's,
Okay.
and so I really was diligent to exercise. That's the best therapy.
Yeah.
So I'm walking 2 miles 3 times a week, and then all of a sudden my knee stops working.
So the knee pain is actually limiting your ability to manage your Parkinson's.
Exactly.
That's a huge consequence of the knee pain, right?
And waiting too long just causes more damage. I waited 10 to 12 years before having to do things that did
Yeah.
my hip and my back and everything else.
Right. So there's a lot of things that we're limited in doing that we miss out on. There's progressive degeneration. So, you know, the longer you wait to address your knee pain, the worse it probably will be, and the more you're stuck in the cycle. So, diminished quality of life. I mean, it's frustrating. There's an emotional toll with pain, right? If you have pain all the time, it sticks with you. It's exhausting. Worst pain I've ever had was rib fractures, though. Whew. That was bad, right, Kevin? You know what I'm talking about. So we already talked about this. What is yours limiting? Really think about that. Because sometimes we don't notice that slide. You know, we don't notice that we are not doing some things that we did 2 years ago or 3 years ago. Sometimes it's very apparent, like Steve here, you know, 4 years ago you were running, now you're not. So those things, but sometimes we don't see that change. My dad's noticed that, like, over the last 10 years, each year just a little bit less, and here we are where he's, you know, not able to walk very far.
For me, this is a new injury. I've never had knee pain in my life before a couple of years ago. And what I'm finding already is as I walk, which I do quite a bit of, I tend to want to limit it because I don't like the pain. And so I guess a question I'd like to address in this is, okay, where do you know where that limit is?
Where's the line?
Where is it that,
Yeah.
you know, I moved furniture and boxes up and down the steps hundreds of times last week, and my knee felt better after that than it had when I was sitting idle. How do you make that balance?
Yeah. Well, and I think that's a little bit of a complicated answer because it depends on what's going on. But listening to it and seeing how it's responding, you know, how much activity is too much. Your body will tell you, but sometimes it doesn't tell you immediately. So yeah, that may be a little more specific conversation on what you have going on. So traditional treatment options. We have physical therapy. I'm a little bit biased. I am a physical therapist, right? Who's done physical therapy in the past? Almost everybody, right? Okay, so that was a pretty good grouping. What about pain medication? Who's taking pain medication?
Holistic things,
Okay,
frankincense, ALA.
awesome.
on and on.
Which can be considered a type of pain med. It's more natural, but it's a type of pain medication. Injections. Who's had injections?
Just
Okay.
stem cell count.
Stem cell counts. And then surgery. Who's had surgery? Okay.
I'm everything on that list.
You were everything on that. So, I mean, physical therapy, that's very common, obviously. Pain medications are very common. We have different varieties. You know, we have natural type supplements, but we also have stronger pain meds, you know, your ibuprofen, your Celebrex, and then we have,
Narco,
exactly. Now we're even getting into another level.
oxy, whatever.
I mean, there's a lot of pain medication, right? Injections, there's a wide range now. It used to be just cortisone. And the problem with cortisone, most people don't realize cortisone degenerates the tissue. So it actually weakens the tissue to, the side effect of reducing the inflammation is that the tissue gets weaker. And so if you do more cortisone injections, you have more weakness in the tissues, whether that's bone tissue, because it's tissue as well, or tendons, ligaments, muscles, anything.
It's
So,
an illusion.
yeah, it feels better.
They do to football players because you're
Yeah.
active and you're aware of what you're doing.
Yeah,
So,
it feels better, but it's just because we took that inflammatory process and we just kicked it all the way down. There's nothing happening at that point. And then surgery, there's a lot of surgical options. So I'm going to give you 3 tips for knee pain, and then I'm going to have Corey talk about something that we're doing now that is kind of checks the boxes for a lot of the things you guys are talking about. So tip 1, and I can email you these. If you, so at the front there was like a sign-in sheet. As you leave, if you just put like a check mark by it, then I will email you these so that you have these these exercises, so that you don't have to make drawings and things like that right now.
take pictures.
Yeah, you can take pictures if you want. So tip 1 is to stretch. Mainly, I mean, I'm simplifying this. Everyone is different. Some people are going to be tight, some people are not. But I'm going to simplify this. Calves, hamstrings, and hip flexors. So I have pictures of all those 3 stretches on there. Going gently. This is not you're trying to stretch everything out immediately, but this helps to reduce the tension around the joint. Usually we'll do gently for 30 seconds and do 2 sets, and do that twice a day to loosen that up. Most people with knee pain have pretty tight hamstrings because the hamstrings guard along with the calf. The calf also starts to guard. The hip flexors can be involved, they might not be involved, but since we sit a lot in our society, hip flexors are a great thing to stretch. So tip 1 is stretching. Tip 2, strengthening your hips. If you came in to see me, most likely I would have you strengthen your hips. And you're like, but it's not my hip that's the problem, right? But if we go and we strengthen the quad muscle aggressively and we don't address the hip, we miss the stability that's needed for that to function correctly. And I would say most of the time, the knee pain that I see is more related to the hip weakness than to the weakness at the knee. So the knee is a hinge. It just goes back and forth. But any rotation, which is more, it injures the knee more, happens from the hip and is controlled from the hip. So we have straight leg raises on your side, bridges. These are very simple. I wanted to put simple ones on here because if we go complex and you go home and do those and then you irritate things, then my ears are burning because you're cursing my name later that day, and we don't want that. So these are simple. If you know what you're doing, you can go higher level in hip strengthening. But these are some basic ones. And tip number 3, activity. I hear someone does aquatic exercise.
That's my go-to. Non-weight bearing.
Yeah,
Best
it's great.
bet.
I'd be dead without the pool.
Perfect.
Me too.
Well, not perfect. I don't want you to be dead without a pool, but that's good. We take the load off of the joint and we exercise and get strength in the other muscles. I think it's fantastic. Biking, biking is technically less weight bearing, and so usually people can tolerate biking better. So I think that, and it doesn't have to be outside biking on the road because it's getting cold. A stationary bike can work out just great. And walking, as long as it's not irritating things too much, like some irritation is okay with that. But you just kind of have to gauge how much irritation you want. Not that you don't want any irritation, but that's okay.
Tolerate.
So this helps keep your muscles strong and your fitness up. So what about when conservative treatments aren't enough? I saw a lot of hands for physical therapy, and you're still here in this room, right? It's like, okay, I've done physical therapy, I've done injections, I've done these things, but what about if you've done multiple rounds of PT? You've maxed out on your cortisone injections because they'll only give you 2 or 3 a year. I know people who are struggling with that. You're worried about taking more ibuprofen because of your stomach, or you're concerned about having another surgery. I mean, these are all concerns that I hear regularly with my patients. So surgery, we won't spend a whole lot of time on this because I'm not a surgeon and we're trying to avoid this anyway, but there are a lot of surgical options. But anytime you go into the joint, the research shows that it increases the degeneration of the joint. So you have to weigh whether that's a benefit or not. So of those who have done PT, think about what did they do in physical therapy? Because not all physical therapy is created equal. I wish it was. But if you went in and they did heat and electrical stimulation and they did ultrasound on your knee, and then they had some high school kid work with you on your exercises, and then they came over and they massaged your knee a little bit and then put you on ice, that's not physical therapy, unfortunately. Yeah.
I've only been to physical therapy once, but I had that experience, and I
Yeah.
felt like they were just there taking the money, and so it wasn't an option for me at that point.
And it's frustrating as a physical therapist.
I did it for 4 months,
Yeah.
and I did hear them over here, the doctor
Yeah.
saying, "Oh, she's got unlimited Medicare," and then I thought,
Take
well,
that
that's
as far
what
as
I
they can
just
take.
have to run, so.
Yeah, and that's a really common thing. So even if it's, oh, I've done physical therapy, well, have you really done physical therapy? Because that is, don't get me started. This is a soapbox for me. I'm not going to go far with
Are there
this.
degrees of physical therapy you're trying to, stipulate that there's?
Like certifications or
Oh, yeah,
specialties?
certification is given. I looked around for 6-8 months before I
Yeah.
chose who I went to. But are there different variants of physical therapy, or is there standard physical therapy?
There's
where you work a joint, you work the subsidiary areas?
There's orthopedic so I'm a board certified orthopedic specialist. But sad to say, that doesn't, I know board certified orthopedic specialists that treat just like I described. So unfortunately, you have to do your homework a bit to figure that out. And a lot of times it's correlated with how much time you can spend with the therapist. Clinics that are very busy have helpers or aides to help them see their patients. And so if we talk about stem cells for a second, because they're all over the place. Chiropractors are using stem cells, all over the place. There is a huge variability in what stem cells are. You have different types of stem cells, you have different ways that they get them, you have different,
Ways they put them in.
if it were me, I would be researching the crap out of stem cells before I do anything. And I would say your experience is very common, about 50-50. 50% it's like, oh, that was really good. And 50% it's like, well, that was an expensive shot. Great. I thought I had, never mind, I didn't put this slide in there. But like I said, not all PTs are created equal, and not all treatments are created equal, and not all training is the same, unfortunately. So, so we're going to talk about regenerative therapy, and regenerative therapy stimulates natural healing, it's non-invasive, and has longer-term results because we're addressing the underlying problem that we're talking about. Quite a bit different than treating symptoms. In physical therapy, we really haven't had a ton of tools to regenerate tissue, and in medicine in general, until just recently. And the research is actually increasing significantly on this subject and showing good results. So last week, Corey went to Colorado and was trained by I forget the name, the American Shockwave Training Institute.
Mm-hmm. Yep, you got it.
And so I want him to talk about what shockwave therapy is, what it does, and it's been pretty cool as when Corey came back, because shockwave has been around for a while. I actually looked at a research study on scoliosis and shockwave, and they were doing it back in 2017. Different equipment. It was like the little brother to this. But so it's been around for a while, but really it hasn't really caught on because I think we weren't in a place to accept that as much, and there wasn't as much research. So I think
they were giving it to all the professional athletes, because I want to know why it takes somebody else like us to take so long to recover.
Yeah.
But a professional athlete can have a torn something, and he's out playing 6 weeks later
There
off IR.
there are a
So,
lot of things,
because
yeah.
they've been getting this stuff for years and years and years.
Yeah.
Yes, I believe that.
Yeah, now it's coming like, okay.
Share.
And to be completely honest, one of the biggest reasons that it didn't come before is it's really expensive to get these machines.
Doesn't cost them anything.
And so, yeah, for them, it's like, just get one for the training room. So that's a big reason. How much is it to get a heat pack and an electrical stimulation machine? Not much. How much to do this? Significant. I'll just put it that way. So I'm going to give this to Corey, and he will continue.
Yeah. I'm pretty excited about this. It was a really good weekend. We got to treat a number of patients over a day and a half, and I got to see some pretty amazing things, stories, testimonies, and like real results within, in one case, as little as 15 minutes of treatment. It has been around a while. This technology was originally used medically to treat kidney stones and gallstones. They would use shock waves to break them up, disintegrate them, and that was decades ago. And like Dave was saying, now we're learning what it can do for soft tissues, but also hard tissues like bone. The way it works, 2 different machines. Essentially what they're doing is creating sound waves, acoustic waves that penetrate tissues. Some at a shallow level, which is the lower machine. The higher machine up here gets really deep. It can get to bone. And that essentially helps with cell proliferation, which is another way of saying cell growth. It stimulates the functions of the cells to get waste out, take nutrients in. And that's how we heal. It hurts, but that's how we heal. And as it heals, the inflammation and pain reduce. Another thing that it does is something called neovascularization, which is a really big word for it helps stimulate blood vessel growth. And we need that because it's the blood that brings in all of those nutrients to the cells. So we're getting cellular activity at the root cause of the problem to stimulate healing, and we're bringing in blood flow at the same time. It's not always a fast process. Not everyone is the same in how their bodies respond over time. Some have different comorbidities, which can impact the healing process, but we know that this happens. The rate at which it happens might vary from individual to individual. We'll get into a little more about that.
Is that good for?
I think the application of this extends pretty far. We're learning still. Today we're talking about what we've seen in the research for muscle tissue, tendon, ligament, bone, nerve. Not so much blood vessel, but it does, like I said, create new blood vasculature. So if it applies to post-DVT, that'd be pretty cool too. Yeah, it's a good question. So it's, as you can see, the benefits are getting you back to doing what you want to do. The time frame on this, like I said, can vary. But for instance, for NEOA, what the data is showing is that this is both a short-term and a long-term solution. You'll feel better within about 6 weeks, up to 3 months, but the benefits of this can extend past a year. For soft tissues, it tends to be faster, but the results stay because we're regenerating tissue, and with physical therapy and activity, we're strengthening that tissue so that it can withstand what it is that you want to do. This is just a tool to stimulate that process. So it works for all of these things, plantar fasciitis, knee osteoarthritis, tendonitis, chronic low back pain, tennis elbow, stress reaction fractures for bone. I haven't had this experience yet, but the data is showing that it can, in some cases, cut the healing time in half for bone healing.
Would that be effective on an avulsion?
An avulsion fracture?
Because that's not necessarily bone.
At the course that I went to, they were treating major and small tears for rotator cuff injuries. If it's completely torn, I don't know how effective this would be. It probably needs to be repaired. That would be a surgical indication. But if it's a partial tear, meniscus tear, this can help. Because again, we're proliferating cellular activity to help grow. We need further stimulus after this is done, which is activity, and it needs to be guided so that we don't overstress the tissue. But yes. So lots of different machines. Everyone's catching on to this. And that's good. That's good for capitalism. But as we all know, not everything is created equal as far as technology goes. Dave, I don't know if you want to speak to what brought your attention to stores, but I can say that this is the best of the best. And the biggest reason for it, I had a question earlier about, what's the difference between this and Shockwave or StemWave or other machines, and quality of materials, which improves how powerful this is. How deep can it really penetrate? How specific can we get the energy into the area? The person using it needs to have training. But I don't think that we can blame the machine if something goes wrong. It's probably user. But this is, it is the best machine out there, which is why we have it. So training, I took the training. It was a day and a half. It was extremely regimented. They had a lot of people there saying, all right, 2-minute warning, let's go, we got to get going. It was the most regimented training that I've had since being out of PT school. And it was highly effective. I learned a lot on how to use it, and we've been working to get everybody trained here in the clinic to use it effectively for everyone that wants to try it. Protocols. So protocols can vary. When I went to this course, everyone there was pretty much like, you see this book of protocols, let's just throw that out the window. You need to understand what the diagnosis is. And you need to understand how that diagnosis relates to the person in front of you. Because again, everyone's a little different, so you need to understand them. You need to understand the diagnosis, and then you use this tool that you understand to get the result that you're after. So basically, we tailor it to you. Your treatment will look different from someone else's treatment. A knee replacement? It wouldn't be for the bone, because there is no bone. It would probably be for surrounding tissues. You need to get to what's causing the pain, understand that, which that's an interesting story for you, Don.
Too long.
So, yeah. Okay, so we talked about one of the reasons why we expect to get better results, and we have been seeing better results, is we have the best equipment. We don't just have one type of Shockwave machine. We have two, one that's superficial, one that's more deep and more specific. We talked about individualizing protocols. We have the training. We also have this machine, which is electromagnetic transduction therapy, which is a way of speeding up the results. What we've learned from magnets is that if you have, I wish I had a board here, but essentially we talked about cell growth and how the cells function, and how this stimulates that activity to get waste out and good nutrients in so it can grow. But how does that exit and enter the cell? It does it through a membrane. In damaged tissue and chronically inflamed tissue, the ionic channels that drive that flow is disrupted. It's not efficient. What this does is it makes it efficient. It establishes a stronger gradient for the area that we're treating to make this work better. So we're combining that with our treatments here. It is a tool. You know, if we just do this, it could be that for some of you, walking, general activity could be enough, and this is all you need. But if you're looking to get back to higher level activities, sports, or just going on a jog, or just high level walking up and down a hill, hiking these beautiful mountains, then we need to train the tissues as well. We need to provide it the stimulus so that what this has started continues. And it continues in a way that gets you to your goals. So it doesn't come back.